My name is Larry Junck, and I'm head of the Neuro-Oncology program here at the University of Michigan. Most of the patients who my colleagues and I treat have brain tumors of various types. Based on occasional reports in the media, some people are expressing concern whether use of a cell phone might contribute to risk of a brain tumor or other tumor around the head and the neck. My main message to you today is that this risk is not of great concern for the following three reasons. Number one, cell phones generate radio waves, but radio waves are not known to cause changes in DNA or the other types of changes in cells that might contribute to causing a cancer or other tumor. Number two, since the era when cell phones came into common use, there's been little change in the number of people diagnosed with brain tumors. Number three, there have been many epidemiologic studies of the risk of brain tumors and other types of tumors in relation to use of cell phones, and most of these studies have been negative. It is true that a few studies have been positive, but the increase in risk in these studies has generally been small, and these studies have not been supported by other studies. All studies have been too small to provide a final answer. More research is needed that includes larger numbers of people, but until then, I think there are more important risks to keep in mind. If there were any increase in risk of brain tumors or other tumors associated with use of cell phones, that risk would be small in comparison to the increased risk of vehicle accidents while using a cell phone, or especially while texting. Finally, if you want to minimize your risk of cancer, your most important measure is to avoid cigarette smoking. Other actions that can help to minimize your risk include avoiding secondhand cigarette smoke exposure, for those over 50 to consult your healthcare provider about colon cancer screening, and for women over 50 to consult your providers about mammography for early detection of breast cancer. These measures are more likely to help reduce your risk of cancer than changing your use of mobile phones.